want to be certain that you listen to this entire program, we have the one and only Senator Sarah Anthony to talk about taxes, homestead property taxes. And we sent some legislation to our national office at AARP, and they said to us that this could be model legislation for the rest of the country. Wow. I've been here 10 years, Senator Anthony, and I've sent a whole bunch of stuff to our national office to see what we can support or shouldn't support. I don't recall them ever saying that before. So congratulations on looking out for older adults and looking out for our property taxes. Thanks for being with us today.
Thank you. Thanks for having me.
So let's just start from the beginning, because you and I kind of delve into advocacy stuff all the time and policy. But for the viewing audience, what are homestead taxes, property taxes? What is that?
So we already have the homestead property tax here in the state of Michigan, and there's different models across the entire country, as you mentioned. What we are designing to do is to expand who is eligible, the income threshold for that particular property tax. We know that oftentimes politicians say, oh, we are lowering taxes for everybody, right? Or we are, addressing affordability. But then when you actually start to look at who actually receives relief, oftentimes it's not the working middle class, it's not seniors. And so I get tired of it. and you know who else gets tired of it? My mama. It's like you're saying that you're giving relief to folks, but the devil's in the details. And so this would essentially be a refundable tax credit that we're expanding so that more people are eligible. And it applies to both homeowners and renters. Because what we hear from seniors is, one size doesn't fit all. Right? Whether you are a senior who, for example, got rid of that big old house after their kids went off and they didn't need that and they downsized and decided to rent. This property tax also impacts them, so they would get some relief. And then homeowners, folks who are middle class, working class, it does a little something for everyone. Because what we have heard from people is that housing cost. Housing cost is one of those drivers that impacts folks across the board. So we wanted to find something that would reach as many Michiganders as possible.
Well, thank you for that, because that's what we hear all the time as well. And it wasn't really on the radar as much 5 or 10 years ago, but the costs have just gotten so astronomical now. We hear everywhere across the country, across the state that we go, we hear about housing costs. Who is eligible for this legislation, not if, when this legislation passes, who will be eligible for this tax?
So we adjusted the income levels to folks with $70,000, roughly around $70,000. And so what that would mean is that whether you own your home or you're a renter, you would be able to receive this refundable tax credit. And this is the cool part about this, is when I have heard directly from constituents, because that's where most of my ideas come from, right? Not just lobbyists, stakeholders, but when you talk to people and they talk to you about their housing concerns. Seniors often tell me, I want to age in place. I want to keep my home, but maybe there's some tools in the toolbox that makes it more affordable for me to do that. Maybe it's revitalizing my home, accessibility needs. Or again, folks who say, you know what, the heck with that big old house and all that comes with it, I want to rent. But making sure that we're lowering costs for everyone is what this bill is designed to do.
And renters, they have not been included in the past, is that correct?
So they have been. They have been, but again, this would expand that so that more people would receive more relief.
And what kind of relief are we talking about? Exactly, let's say you said $70,000 would be the threshold?
Yep, and then it actually increases based on if you're a couple. This is another piece of that. I think it's around 140 or so that if you are a couple, you could also do the joint filing and receive even more relief. So, and all of those details are on our website. So I want to make sure to give a shout out to our Senate website. If folks just look up Senator Sarah Anthony, they'll have a landing page where folks can learn more about the details and how, quite honestly, relief would look for them. And the one other piece that I think, your viewers would be really interested in, and what makes AARP so powerful, is you all are nonpartisan, whether you're Republican, Democrat, Independent. And it was important for me to partner with someone on the other side of the aisle. So this is a bipartisan bill package. You have someone like me who, is a Democrat working alongside a Republican woman in Michigan. And we just said, this just makes sense. Because whether you're in an urban area, rural, suburban, folks in Michigan have just said they need relief. They need things to be more affordable, and everyone has housing costs.
And you talk about AARP being nonpartisan. We're nonprofit, we don't have a PAC, we don't give any money to any organization. And like you said, we listen to the voices of the people.
That's right.
And it seems as though, and I'm going to shift just a little bit, we'll come back to this, it seems as though that's not happening as much in our Michigan legislature or in our Congress. It's just not happening as much. It's more political. So how are you hoping to get bipartisan support to get this over the finish line? Because this is about people, not politics.
That's right. That's been, my secret weapon in the legislature. I've served in the House, I've served in the Senate, I even served on the county level. And the thing that has always been the most powerful lever is looking at how do we serve people first. And when you think about, all the things that divide us, take those things off the table.
Right.
And when you look at things like healthcare, food access, and having a roof over your head, you can get rid of a lot of the political theater. But to your point, Paula, it's toxic right now. There are folks who see it as a game. And I don't see politics as a game. I see politics as a way to really provide essential services for folks. So whether you're from birth to earth, that's how I like to say it.
I love that. And let's give you your kudos as well. You started out with Joan Bauer as an intern or as an intern.
Legislative aid and
and then the youngest, give me a little bit about your bio. The youngest commissioner in the country? In the country.
Youngest Black woman to serve as a county commissioner in the United States. And I've been honored that the voters keep saying, you're doing a good job, right? So, being the first African-American woman to chair the powerful Appropriations Committee. And for folks who don't know what appropriations, it's the money.
It absolutely, and as long as I've been around, I think between you and between Angela Whitworth. What you've done for our communities, as both of you being chair of the appropriations, both the House and the Senate, it's incredible. Absolutely incredible what you've done.
This is not to discredit our men, right? But women know how to come in and clean house.
Oh my.
we know how to look at things and say, that doesn't really make sense. And how do we do that more efficiently?
I sit on the Food Bank Council of Michigan board. I sit at McLaren Hospital Healthcare, Davenport University chair. And I'm sitting there and your name comes up. Well, she did this. Senator Sarah Anthony, we've got to make sure we send her a note because she did that. Or the food lunch program, or Senator did this, or, it just goes on and on and on. So the power of that committee is just incredible. And thank you for not forgetting where you came from.
That's right. Well, budgets are moral documents. So you can tell me you care about children or seniors, show me the money. And that's a part of why when we look at how do we give relief to the most amount of people for something as practical as possible, that's why that was the genesis of the homestead property tax. And so, I mean, it's a big price tag. It's a big price tag. It's around $300 million that would come out of the government's coffers. We think that it's worth it. Passing along that relief to seniors and to working moms and to middle class families. Oftentimes people get cynical about government because they can't point to what government's doing to them for them directly. And so this would be one of those pieces that if we can give a little relief to folks, I think it would also reframe how people feel about their government.
What are the barriers to passage?
Always politics. It's but one thing that I'm excited about again is that it's bipartisan. And so that's by design. And most of the bills that we've introduced and gotten signed into law have been bipartisan. But we're in split government right now. The Senate is controlled by the Democrats, the House is controlled by the Republicans, and we have a Democratic governor. So we're learning how to work well together. There's been bumps along the way. But the other piece is that with so much happening at the federal level, we have a scarcity of resources. There's not as much money in the state's coffers. So not only politics, but also limited resources are the barriers. But once I put my mind to something.
I know. And that's how AARP is. Once we fight to win. So we keep the fight. We just look at lowering the price of prescription drugs. It took 20 years to have Medicare negotiate the price of prescription drugs. Big Pharma came out after us every single time, but We won, and we won as a result of the people lifting their voice, calling their state legislator, their congressperson. We won as a result of the people, not as a result of politics.
And you were also instrumental in one of the biggest and best accomplishments, I think, in recent years, which is that retirement tax.
Yes, pension.
Right?
Yes,
I mean, the fact that when I see one of those red T-shirts, someone from AARP that comes to my coffee hour and says, I've got something to say about a caregiver tax or about the retirement tax. These are powerful voices that elected officials on every level, we look to AARP to guide us, to try to help us frame what we're doing in that capital.
I knew you were smart.
Yes.
I tell everybody she's so intelligent.
Yes, and we just appreciate the partnership. AARP is an amazing partner.
Thank you, we appreciate that. And we appreciate you always letting us know what's going on and what's happening so that we can partner and collect and collaborate on some of these issues. You mentioned something that's also near and dear to our heart, and another pivot, and that's caregiving.
Yes.
I know that you're very familiar with caregiving and the 1.7 million unpaid family caregivers in the state of Michigan that saves the state of Michigan money as a result of them keeping their loved ones at home. I can remember going into Asian American Pacific Islander community and talking about caregiving, and someone said to me, I don't even know what you're talking about. This is my mom.
That's right.
You know, so they don't even consider it a job, but yet it saves money. It saves the state money. Where are we with the caregiving tax credit or some help for unpaid family caregivers?
That's right. So in the Senate's budget recommendation, we did add the caregiver tax credit as a part of what the Senate definitely wants to prioritize and see in the state's budget. If it's not this year, we're going to keep fighting for it year after year because it's that important. We've seen that our governor is also supportive and has put it forward in her recommendations in past years. So we're going to keep fighting for it. It's just that important.
We appreciate that. So let's get back to the homestead property tax. Out of the young people, you said it would help young people, will help anyone. It's not an age, it's more of a tax income level.
That's right. That's right.
And so is there, who's not going to be eligible for it?
Yeah, and again, we already have this. This is something that over the course of years, the state of Michigan has already had the homestead property tax. This would just be expanding who would be eligible. And this is something that, you know, whether I'm talking to folks at AARP or single mothers, you know, I've been going to different churches and groups because folks get excited about having their, you know, their housing costs lowered. And oftentimes when we hear from seniors, they will say, government's not working for me anymore. That so much of the relief is for folks with young kids or folks who are unhoused or folks who, you know, are in such low income thresholds that folks who are in their 60s and 70s and who have done the work and maybe have a pension, some don't have a pension anymore, they get left behind. And so again, I think that it's powerful when we can find levers that have a broader impact.
So it's putting more people into the net, the safety net, the protection net. That is so powerful. What's the next step in terms of the legislation? Where is it now and where is it going?
That's right. So we're fighting for a hearing at this point. We want to hear from people across the state. I want to hear from folks, whether it's seniors, young people, folks we want to keep in Michigan as we're facing a housing crisis. We want to hear their stories because often those are the stories that we bring into our committee hearings. Those are stories we amplify on social media. So we ask folks to reach out to us and tell us, how is the housing crisis impacting them? And how would having a little bit of relief through the homestead property tax credit, how would that benefit them?
We can help with that. This program hopefully will help with that as well. And there's a website here for people to contact you on the Senator Anthony, Sarah Anthony.
It's just tell them to Google State Senator Sarah Anthony.
We'll put it on the web. We'll put it. There's a link on there on the site so they can see that. Affordable housing is still an issue, though.
Oh my goodness.
Finding housing is still an issue. Downsizing is an issue. Young people who can't afford to live in White Hills or somewhere, it's still an issue. I know you had some thoughts and ideas too about affordable housing. Can you share those?
It is a crisis, right? It's finding a quality and affordable housing. We can't build fast enough. We think some of this is like global economy, economics, the cost of lumber, the cost of labor, just to be able to keep up with the demand. We also have a ton of aging homes. You know, you look at some of our corridors across the state, even here in mid-Michigan, the homes are falling apart. And so how do you attract people to a community if they can't find homes that look like anything, or that the boiler and the roof and things are falling apart. And so I think making sure that we're building more, we're building new, we're repairing what we already have, and then we're giving relief to folks who like their home, but could just need a little bit more just to like cut those costs, because everything else is still rising.
Yes.
Despite some of the political and campaign promises from everyone, costs are still going up.
Absolutely.
And until we can really see significant relief on the national level, Michigan needs to do its part and give relief to people.
What are you hearing from builders, contractors, residential, commercial?
Yeah.
What are you hearing from them in terms of
the cost of materials is still rising, and they can't find people, right? I mean, you know, one of the big things that I've always prioritized is skilled work, skilled labor.
Absolutely.
And we can't find enough people who are going into the skilled trades to know how to build a home, how to build an apartment complex or a condo. And so, you know, it's kind of a crisis for a reason. It's because every single side of this requires a lot more ingenuity and resources, even zoning laws, right?
Yes.
Some of our cities and counties need to come into the 21st century and realize we can't do what we were doing in the 40s and 50s.
Remove the red tape.
Yes. So, and I know that AARP has been instrumental in making sure that, you know, communities are walkable, bikeable, and that they are what's the term for it?
Age-friendly community.
Age-friendly communities, right?
Absolutely.
You see, when you all come in my office, I listen.
You do. You
So.
do. And the age-friendly community, that's the foundation for everything. It's everything from education to homes to healthcare, everything we're talking about,
right.
that is the foundation. And sometimes people think that older adults are a burden on the community, but I'm here to share with folks that if you have older adults in your community, they're still going to buy cars, the healthcare, they're still going to maintain their healthcare. They're on a fixed income, but they're going to use that income to go to the movies, go to the dinner. They add to the economic development of that community. They're not a drain on the community, so you want to keep them in the community as long as you possibly can and not have them move into Florida or somewhere else, right? So,
when older Michiganders do well, our entire state does
Exactly
well.
right.
Our children do better.
Exactly
Middle-aged folks who are
Exactly
still
right.
trying to be young like me. We all just do better because, you know, the communities are richer, they're more vibrant, the economy, you know, everyone does better.
Absolutely. And I wanted to share something with you. We were in Ann Arbor, our executive council, Lori Richard Jandron, and the rest of the executive council, meeting with some organizations there. And the number one thing, we asked them what's their number one issue. Guess what it was?
What?
Housing.
See?
Housing.
Everywhere.
Yes, it's housing. And Washtenaw just became an age-friendly community, by the way. And so we've got a coalition now, because we all said we're going to join together to help push this legislation through. So it's not just going to be AARP working alone, but like I said, when we fight to win. We got a cavalry.
Yes, you do. Yes, you do.
Right there to support us. So there's a tremendous number of organizations who are going to be supporting this legislation moving forward. And again, people can, like you see on the website here on the screen, they can contact that website to have to absolutely show their support. So in the 2 minutes or so that we've got left, what's top of mind for you? How do you want to finish out this term? What do you besides the homestead property tax? What else would you like to have accomplished?
You know, there's been so many changes that have happened at the federal level that are going to impact Michigan families. There's no doubt about it. That big bill that passed recently, it is going to impact the social safety net for Michiganders and for people all over the country. So with the limited amount of resources the state has, we are charged with trying to figure out how do we ensure that our most vulnerable populations are okay, and that our citizens, whether they are low income, middle income, older, younger, that we have enough to ensure that they will be okay. That's at the top of my mind. You know, that's the other side of being the chair of the budget committee, is that yes, you can give out a lot of money to do new programs, but now it's about sustaining and maintaining the gains. And so that's the big thing that's at the top of my mind.
And what are the barriers to making that happen?
It's always politics.
Politics.
But you know what's more important and what's more powerful than politics? Are people.
Are the people.
Are the people. Yeah.
Well, the people that are in the state office, the people that we represent, the members that we represent across the state, these are issues that are important to them. And I wanted to say thank you for listening to the voices of the people and not listening to the politics.
That's right.
It takes a lot of courage to do some of the work that you're doing. So again, we're going to fight, and we're going to fight to win.
Thank you.
Appreciate you.
Appreciate you.
Thank you so much for being here with us today. And let's just keep working together on behalf of the people.
Yes.
And thank you for watching. And again, go to that website if you want to lift your voice and talk about how important this homestead property tax would be to you. Personal stories make a difference. Thank you.
I'm Tracy Anderson with Impart Alliance at Michigan State University. Today I'm here with Dan and Jennifer Digman from Mount Pleasant. We're going to talk about the shortage of direct care workers here in Michigan. At present, our state needs at least 36,000 more direct care workers to meet the current needs of our state.
And that's a big number. I mean, and people need that care to stay in our home. And it's important that not only do we need that, but we need politicians, we need government officials, legislators to support us staying in our home and funding programs like this. And it's very important to the quality of my life and Dan's life.
I think that's the big thing. That's one of the things that really allowed us as two people with MS to get married, is knowing with the Michigan My Choice waiver program and funding for that allows and provides for direct care workers to come into our home, and so that we can continue living in our home and contribute to the local community. And I think that that's the big thing for legislators, is we always come down and advocate for state funding to continue supporting this program that allows us, and it's not just us, I mean, think of everybody throughout the state that benefits from something like this.
The workers benefit and the people on the other side. It's a win-win for both of us.
If you had a message for our legislators, what would that be?
Keep the funding, support direct care workers, support people with disabilities.
Thank you both. To learn more about Impart Alliance and our advocacy around direct care, please visit our website at impartalliance.msu.edu.
I want to talk today about why long-term care is so expensive. And back in the day, our grandparents kind of made it through sitting in a rocking chair on the porch. Why is it so much more expensive?
Yeah, Paula, let me put you in a rocking chair on a porch.
That's not going to work,
and we'll
David.
See how
I
well
said my
you like
grandparents. Right?
That's right, right.
Not even my parents.
Well, I blame AARP.
Oh, you do?
I do. I blame AARP because you kind of raised our expectations about what this part of life is going to be like.
It's great.
Now, well, it's a good thing. Yeah, I'm not really arguing with it. But as medical science has progressed, we're all living longer, and more importantly, we're living healthier, right? And as our expectations of what our life is going to be like is up. Right? And so we're living longer, all the rest. But what we didn't do, that our parents did, was have a ton of kids.
To take care of us.
Right. There are 8 kids in my family, okay? None of it, I had 4. That was as far as it got, right? So the demand for services, the demand for care is going way up. There's this thing called the baby boom. You may have heard of it, right? So it's going up. We have high expectations, but we didn't have as many kids. So
supply and demand.
Supply and demand. Demand for services up, supply of caregivers down, plus the church lady who used to hang out and help out, she's not around anymore.
And the cost for a registered nurse is
$100 an hour. You want a registered nurse to come in. And of course, you can always get the teenager, with the purple hair, she'll show up, or he'll show up, for $30 an hour. What are we supposed to do?
We're supposed to get more direct care workers into our homes. That's
There
what we're
you
supposed
go.
to do. All right, thank you, David. I appreciate you being here.
Thank you, Paul.
Pain. We all experience pain. And Dr. June is here today to tell us, if you have pain in your joints, what should we do?
That's a good question. We came from a time and era where physicians as a whole kind of went from, you're just going to deal with it, to anyone should be in no pain at any time, 0 pain. And they kind of went to this pendulous thing where people would be given like narcotics and high doses of painkillers, and it got a lot of people into trouble, and then kind of dialed it back, and nobody gets them now. And we're trying to find an identity of what is it that we do which is the correct steps for people's pain, because nobody wants to suffer needlessly. Right. Now, there's a lot of modalities for dealing with pain, and I mean wide modalities, anywhere from Tylenol that works for some people, not most, the NSAIDs like ibuprofen, Mobic, things like that, Celebrex, naproxen, and those carry risks with them too. They do work for inflammation and pain to a degree, but They also have long-term side effects, which your doctor would talk to you about. And then there's alternative painkillers such as antidepressant pills, which take pain out of your body for ways we don't even know. There's topical NSAID creams you can put on. There's natural occurring remedies that are out there that a lot of people use, like fish oil, cherry juice concentrate, something called devil's claw, which has been used successfully for some people's pain. So there's neuropathic painkillers like gabapentin. There's a product called pregabalin or Lyrica that's used quite a bit as well. So there is a lot of medications, depending on the person and the nature of their pain, that they can use for helping get rid of it. For me in our office, we like injections to help reduce specific joint pains. And sometimes that can last months to years. Sometimes it's ineffective for the patient. So you just start by talking to your primary care and then get sent to a rheumatologist or a sports med doctor or physical medicine rehab doctor, and they can approach your pain as best they can.
If you have pain, you're not going to get a chance to see your doctor right away. What's the safest thing to do? Fish oil, or what's the safest thing to
for
do?
day-to-day, long-term maintenance, it's like fish oil and cherry juice concentrate. But for acute pain, depending on the situation, is go to an urgent care, or sometimes even an ER if it's disastrous amount of pain. So someone that can get you in right now and address this.
Hopefully you're not in pain, but if you are, that's good information. Thank you, Dr. June.
CATA's regional mobility solutions can help seniors seize the day. Hear what riders and community leaders have to say about the value CATA brings to the lives of aging adults.
My name is Richard Foster. I went to junior college, graduated with a degree in writing and photography. When I graduated from Eastern Michigan, I moved up to Lansing. Then my car died and I started using the bus, and I've been using the bus for a little bit more than 20 years. CATA is extremely valuable because it allows me to get around anywhere in the city, and now with some of the extended services, I'm able to go farther out of town. The money I save with the Veterans Pass allows me to go to movies, go out to dinner. I use CATA for everything pretty much. Shopping, going to the doctor, going to the library, anything that I don't feel like walking towards. Between where I live, there's 2 stops, one to the west and one to the east. And it's nice when I get up in the morning and have to go somewhere, I can either catch a bus going out, or if I have to do something downtown, I go across the street and catch the Route 8 when it's going in. Well, I've gotten to know all of the drivers. I know a lot of them by first name. It's nice when I can hop on the bus, say hello, they know my face. It's like hi, and I make jokes with them, carry on conversation. I think CATA is necessary for the community because, there's a lot of people that don't have transportation. Plus, it's good for the environment. I think CATA's doing a good job.
You've heard so much information today, and one of the things that I'm asking you to do is share it with others. Make certain that you share that website, because everybody needs a break when it comes to their homestead property tax. Thank you for watching AARP Real Possibilities.